Good afternoon and welcome to our Facebook Live presentation this week. First of all, let me let you know that this is an educational presentation. It is not meant to take place of any professional or legal advice. So if you need someone, please seek one of those people. Today, we have the honor of having with us Kathleen Pursell of Arkansas SMP, and she will explain to you what the SMP stands for. Just to let you know that here at Alzheimer's Arkansas, we are still providing services and grants and resources. So if you need to reach out to us, please do. So I'm going to let Kathleen start with her presentation.
Hi, thanks, Carolyn, and
You're
thanks for
welcome.
letting us be on today. We really appreciate you.
It's so glad to see you. You seem like I haven't seen you in months.
I know it's hard not seeing our seniors and caregivers and things, and this platform is making it really great to be able to still reach people. So thanks for letting us be on today.
You are more than welcome. So you can have your way, and please, I may ask questions, but if any of you out there looking or listening would like to have a question for Kathleen, please feel free to send it in and we will get it answered. So again, Kathleen Pursell.
Yes, that'd be great. I'm not in the, okay, so I'm with the Arkansas SMP program, and we're going to talk a little about what the SMP program is. We're going to give some examples of fraud. We're going to talk about the latest scams, including some surrounding the COVID-19, and then also the importance of reading the Medicare summary notice, especially if you're a caregiver. Before I get started, I want to mention the 2020 census because there are some changes due to COVID-19. But first of all, there's a fake questionnaire going around that we've heard about. So you need to be aware of certain things that will not be on the questionnaire. And one of them is that it'll never be asked is for the Social Security number or the Medicare number, any kind of bank account information or credit card information, and they will not ask for any donations on a legitimate survey. So also look for the address to make sure it's from the Department of Commerce or the United States Census Bureau, and it'll also be from Jeffersonville, Indiana. And there's something you need to know, that you have a little longer to submit your surveys because since the social distancing, they cannot go door to door. So they're extending submission of the surveys until August 14. So don't be surprised if you hear from some survey people. So what is the SMP? Let's get into our program right now. So SMP stands for Senior Medicare Patrol. We are a education program. We don't go around patrolling and arresting people or fraudsters. So we are an education program. We cover the entire state with our message of fraud prevention. And because of that, we have a lot of partners that help us do that. We have strategically placed partners throughout the state that do the same thing for us and help us to spread our message. This SMP program is also a national program. So there's one in, at least one in every state. So we speak to our national programs every month and compare notes and information and scams that go around. So it's a pretty important program. It's also a volunteer program. I am the director of the Senior Medicare Patrol in Arkansas, and we have one other staff member whose name is Dee Edwards, and she is our volunteer coordinator. So we recruit and train volunteers to help us throughout the state as well, and that's very helpful when, especially if we have something scheduled in Northwest Arkansas, we can have our partners up there to help us spread the message, so we don't have to travel or spend money staying overnight or traveling. The mission of the Senior Medicare Patrol is to empower seniors to prevent healthcare fraud. And we do this through outreach and education, making presentations, sitting at exhibit booths, giving out our information at health fairs. We speak anywhere seniors gather, senior centers, senior housing communities, senior church groups. And they're always very successful when we go to church groups, pretty large gatherings, and they're very receptive of the message. Also, civic clubs, anywhere seniors gather, older Americans. So what is the importance of our program? Why is it so important? Because the number one crime of the 21st century is healthcare fraud. So it's pretty rampant. And senior citizens are our number one target, people who are Social Security recipients and Medicare recipients. So we are trying to protect them as well. You may be surprised to know how much the loss is to healthcare fraud, waste, and abuse. CMS estimates that $60 to $90 billion is lost annually to fraud, waste, and abuse. And that is what contributes to the high cost of Medicare. We're trying to save the money in the Medicare Trust Fund. The goal of the SMP is not only to protect seniors from fraud and scams, but also to protect the money that is in the Medicare Trust Fund. And we do that by reporting any errors that you see reading the Medicare summary notice, and we get those improper payments reimbursed to Medicare. How do we do this, and how do we empower seniors? By educating them. We educate them with 3 simple steps to protect their personal information, to detect fraud, errors, and abuse by reading the Medicare summary notice, and then reporting any kind of discrepancies or errors or suspected fraud to the SMP program. Let's talk a little bit about who it is that commits fraud in healthcare. You have providers, anyone who provides a service to Medicare, Medicaid, and then bills for those services and products. So we have physicians in hospitals and clinics, supply companies, durable medical equipment supply companies, diabetic supply companies, also pharmacies. You may have some rogue employees that work for these places, ambulance companies, which is something that we don't hear much about, but they will bill Medicare for emergency transports when they're actually taking someone to dialysis or to a doctor's appointment. So how do they do this? How do they commit fraud? They bill for services or products that were never provided. Most of the time, doctors' office visits, surgeries, any type of procedure, medical procedure, and then they'll bill for services that were not provided. They also bill for services that are not medically necessary. We'll give some examples of these in a minute. And then they're going to falsify their records to reflect their billing. Okay, one example is a rheumatologist that charged Medicare $325 million and gave chemotherapy to his patients that didn't need it. An oncologist who gave every one of his patients chemotherapy treatments that they didn't even have cancer. The most egregious one I think I've heard. And then the cardiologist that implanted pacemakers in 200 patients that did not need pacemakers. Those are pretty egregious fraud right there. So hand in hand with fraud goes scams, and everybody loves to talk about scams and tell about the scams that they get. And we really appreciate that when people report scams, even if they've been around for a long time. Sometimes they've been off the radar for a while. And when someone calls to report it, then we know that it's back, and we know where it has come back and what part of the state. So the goal of a scamster is to obtain personal information. And by that, I mean this Medicare number, Social Security number, bank account information, date of birth, also, and your correct name and spelling of your name. So they need to verify certain information. And what do they do with this once they get it? They steal your identity, and they also bill your health insurance fraudulently. So they steal your medical identity as well. Current scams that I'm going to talk about a couple that have been around forever. The durable medical equipment scams, where they're selling braces, diabetic supplies, back brace, knee brace, shoulder brace. Those have been around for a while, where someone calls either from a supply company or they say they're with a supply company, or they say they're with your doctor's office or something like that, and they're giving away free braces to Medicare recipients. And so that's when they ask for the Medicare number. And if you furnish the Medicare number, then you get the brace for free. So a lot of people are willing to give that information to get the free product. However, sometimes they don't get the free product, or they get a whole box of braces instead of just the one that may have been talked about on the phone that day. And so they have billed Medicare fraudulently for items that your doctor did not prescribe, things you probably didn't need and wouldn't have ordered anyway, but since they were offering for free, you took them. And so this is how they get paid by Medicare, by sending your supplies to you, or billing Medicare for supplies you didn't order. Another scam that's been going around for a while is impersonator scams. They impersonate government agencies like Social Security or Medicare. Like the one I just told you about, the DME scams, is when they say they're with Medicare and they're offering free braces for Medicare recipients. Another one is the Social Security scam, where they call stating that they're with Social Security and that your Social Security card has been involved in criminal activity. And a lot of those, and most of those, took place, they say took place in Texas. And of course you say, well, my card was not involved in criminal activity, I have it with me. And then they give you another phone number to call, or they'll transfer you to some number, and that's when they'll give you a case number, and then you'll have to ultimately give your Medicare Social Security number to resolve the issue. Also, there's calls like from the Federal Trade Commission, and everyone's heard of the IRS scam, where the tax scam, you haven't paid your taxes on time or something like that. So 1 in 5 people fall victim to scams, and they lose a lot of money. If they do fall victim, there's a lot of money involved usually, and it's on average of $1,500 per person. That's really a lot for our seniors. Another scam I want to touch on just briefly is the DNA genetic testing scams. This went around a couple of years ago. It was nationwide. It was also in Arkansas. It's kind of taken a back burner to COVID-19 testing scams. So we'll talk about those in a second. But this was a nationwide scheme where a lot of people were getting paid a lot of money. The people who were doing DNA genetic testing swabs were being paid, and they would go door to door in senior housing communities. They would call on the phone. They would email the special that you could click on and get a kit to do a DNA genetic testing to see if you are susceptible to certain types of cancers. So a lot of people were doing this because who doesn't want to know if they're susceptible to cancer? So it was pretty rampant, and a lot of money was being exchanged to the people who was giving the cheek swab, to the labs who were supposedly doing the lab testing, and then the company who's supporting all of them. And it was just a high-paying scam. And of course, they were billing Medicare for services that were never provided. Most beneficiaries would call when they realized that the kit never came in the mail, or that they had submitted the kit and they never got the results. One of the bad things about that is sometimes they would get results and it would say that they were negative for cancer, which gave them a false hope where they may not go get screened for cancer after that. Right now, as it relates to the coronavirus pandemic, we're trying to send out alerts to the public about these new scams that are going on. Of course, scamsters follow headlines. They follow any type of disasters, natural disasters, or public health emergencies. So they're right on target with the COVID-19 scams. So what they're doing is there's a Social Security scam going around right now that they're sending out fraudulent letters stating that their Social Security number has been suspended. because of their offices being closed due to the pandemic. So it's misleading them into calling a Social Security number, giving their Medicare number to them, their Social Security number to them, and in order to make sure that they get their check on time. So the Medicare impersonator scams is when fraudsters are approaching door to door right now. They're going door to door and posing as health agents, or we've heard that they are posing as CDC, Centers for Disease Control agents, and they're offering free vaccines, free COVID-19 testing, any type of other treatment, lotions, creams, and things like that, and masks. So they're getting Medicare numbers and Social Security numbers and whatever they can get from older seniors, so they can steal identities. Another thing going around with the COVID-19 is the stimulus checks. We're all expecting that check in the mail, aren't we? So they know that. And they're getting calls from people stating they're with the IRS, and they have been trying to get in touch with them, and they need to verify their Social Security number. They need to verify that they received the check that they mailed them, and they try to get personal information and money so that they can get their check mailed to them sooner. And there's no way to get your check sooner. There's nothing you need to do to get your check. So that's another thing going around. They also want you to deposit the check that you got and then pay the difference. It's an odd amount that you get sometimes on these fake checks. And so they say, we've sent the wrong amount. Please deposit the check and send us the difference. So you don't have to do anything to get your check. No one's going to call you for any additional information in order for you to receive your check. There's not a fee to receive it. There's nothing you can do to pay to get it sooner. You don't have to give anyone who contacts you any personal information. If we can't get any message out clearer, is to never give personal information, Social Security number over the phone. Anybody who contacts you, whether it's the phone, whether it's email, whether it's Facebook, anything like that, text messaging is starting to be a way to scam people now. So it'd be good to never give personal information to anyone who contacts you, any of those ways. So what can you do to prevent fraud and scams? This is where our 3 simple steps come in. Protect, detect, and report. So number 1, protect your personal information. Never give information to anyone who calls you, emails you, texts you. We've just talked about that. And social media is a really scary way to give personal information. So don't ever trust people that over those formats as well. So government agencies will never call you. Social Security will never call you. Medicare will never call you. The IRS won't call. Health departments won't call, especially to get personal information from you. So never give personal information to someone who calls you over the phone. We just suggest you don't even answer the phone anymore. It's hard to trust caller ID. It's hard to determine if whoever's calling is legitimate and that they are who they say they are. So if you do answer the phone and it's a robocall or it's someone asking for personal information, a huge red flag should go up and you should just hang up the phone. Also, the Federal Trade Commission had a slogan out a couple of years back, and I still use it every time: pass it on. If you can ever tell anybody about scam calls you've received, any kind of fraud that's going around, you can tell everybody you know. Don't be afraid or ashamed to tell a family member or someone else to that the scams are going around. If you tell your friends about them, you will prevent them from falling victim. So pass it on anytime you can and prevent someone else from becoming a victim. And then report all the scams that you receive to us. It would be great to know, because we don't receive scam calls. If you're not on Medicare, we don't receive the healthcare related scam calls. So it's great to know about them. And, I told you that the Senior Medicare Patrol has programs in each state. So that's where we hear about scams that are going around in other states. And we like to report to each other because they're going to be coming over the borders to our states as well. So that's a good way to get the information out to us. Detect is our second step to preventing fraud and abuse. And actually, the detect portion of reading your Medicare summary notice is one of the most important ways to prevent healthcare fraud and also to get the money reimbursed back into the trust fund. So this is the only way to detect fraud, errors, and abuses by reading the Medicare summary notice. So it's really important that you open that when it comes in the mail. If you just glance over it, you will notice very easily things will pop out at you that just aren't right. I know that sometimes it's not as easy to identify errors. If it's a certain code that you don't understand, we're happy to help you decipher the Medicare summary notice. We also have some materials we can give you, how to read your Medicare summary notice pamphlet. And just give us a call. We'll have information on the screen at the end of this. There'll be information for you, but you can call our offices and we will mail you this how to read your Medicare summary notice. And we have all types of other products we can give you to help you do this and to protect yourself. We also have something called the Personal Health Care Journal, and it's a calendar book, but it's also a journal where it keeps track of your health care and what happens to you in doctor visits, so that when the summary notice comes later in 2 or 3 months, then every 3 months, right? So you can compare them and make sure that what Medicare was billed for actually happened to you in that doctor visit. So why do you review your summary notice? It's because criminals hope and pray, and they know that a lot of people do not read those summary notices. So that's how they get away with it, and they know that. And then also future claims may be denied to you if your statement shows that you've received a certain procedure and you can only receive that once a year, then maybe you will be denied when you actually need that. Also, products like a wheelchair. We've seen several cases where wheelchairs were denied for someone after surgery because their Medicare statement shows that they received it some other time within that 5-year period. So how do you look? What do you look for when you're reading that summary notice? You're looking for errors. You're looking for things that just aren't right, don't look right, don't seem right. So you're calling to report errors. You're looking for errors. We're not looking necessarily for fraud or to turn in your good doctor. You can also look for things like double billing. There will be 2 exact claims filed and listed right on top of each other, and that's just usually that's not normal. That's double billing. And then it's also really easy to see out-of-state providers. It's highly unlikely that a out-of-state provider is billing for you. However, not too long ago, we did get a call who received a claim from someone out-of-state provider, and after we investigated it, found out that they have a mobile unit that goes from state to state. So, but it did not hurt to call and check on that, and it also made us aware of that type of billing. So always call about things that just don't look right on your statement. You're also going to look for things you did not receive. Say if you did the DNA genetic testing kit and you see on there that they were paid, they billed Medicare and were paid for a lab test regarding that DNA test, and you didn't ever receive your results, or you never received the kit, then you can call on that. This is maybe you I don't know. I'll just go on to the next. Maybe you received things but didn't order them, like the back brace, the knee braces, and you told the scamster on the phone, no, I don't want those. But somehow he either had your Medicare number or you gave it over the phone, and that's how you become a victim. And so you never received it, but you see that they were paid for it. So that's what you would also look for and call us about. So thirdly, while you're reading the Medicare summary notice and you do see these things, it's real important that you call and report them. We suggest that you first call the provider, tell them that you're reading the statement and that you noticed there was an error and that you would appreciate them reimbursing Medicare for it. And if you don't want to call your provider, or if the provider does not take care of it or help you to your satisfaction, you can call us and we will work with them from that point on. But at any point, if you see an error in your Medicare statement, please call us or call your provider about it and get it reported. You know, we were talking about there was errors. And so anytime there's an error, we want that money reimbursed into the Medicare Trust Fund. Also, if it's for a charge for something you didn't get, like a wheelchair, then that way you can get that taken off of your medical record so that when the time comes that you might need one, you won't be denied that service or product. So once you send your Medicare statement and you call and report your error to the provider and they say they're going to get that taken care of, I wanted you to see that you will get a summary notice that shows that claim again. And here's just, I don't know if you can see this, but here's just one way of knowing that this was taken care of by the provider. You're going to get another Medicare summary notice and it shows this same charge. But as you'll notice across the board, it has know that it was adjusted and it has zeros in those amounts paid the provider. And the notes section says this adjustment has resulted in an overpayment to your provider. And your provider has been requested to pay a certain amount. So that's how you know that the provider did go ahead and get this reimbursed to Medicare. And it's in Medicare's hands now, and they will take care of it from that point on. So I am through with my portion of this presentation, and I wanted to give you some information in case you needed to call our helpline, or if you want to report any kind of scam or fraud, if you need help with your Medicare summary notice or calling your provider. If you want any types of materials that we offer, education materials, and also if you would like for us to come speak somewhere. We travel the entire state. There's no charge for our presentations, and we bring all of our materials to give away and some goodies as well. So anytime we can come speak, we would appreciate it. So give us a call if there's someplace you think might benefit from our presentation. Our website is there. It's kind of long, so we're going to leave this up a minute so you can write it down. Also, we have a Facebook page, so go on and like us if you are a Facebook person, and like our page, follow our page. You can see our scam alerts, our latest newsletters. We do have a newsletter that comes out quarterly. You can call our office to get a copy of that as well and to be added to the list. But okay, that's all I have for you, Carolyn. If there are any questions.
Yes, we have 3 questions. That was very informative, but we do have 3 questions, Kathleen.
Okay, great. Good.
Can she see?
What information can I get from this?
What information can I get from the scamming?
From the scammer.
From the scammer, that would be helpful. Like, is there anything should I get from them?
Yes, that's a great question. A lot of times when seniors call in, they say, I have got a scam call and I knew it was a scam, so I just hung up. And they don't even know what they were calling about. So it's real helpful to get any kind of information that you can from them. Like they'll call and say, I got a call from someone stating they're with Medicare and they were offering a free brace, but I just hung up. Now that's good. And that's important to know. But the longer you stay on, it scares me to let a senior stay on longer because they become friends with them and they end up giving information. But if you stay on knowing it's a scam and you know you're not, like if it's a caregiver and they know they're not going to give this personal information out and they just want to get some more information from the scamster, anything you can obtain from them, what they're calling about, who the company they say they're with, what they're asking, like, is it money they want? Is it a social security number? Is it a Medicare number? Any type of information you can get from the scamster is super helpful to us. Just don't get information.
Okay, so our next question is very important, and it really gives purpose to why you do what you do. Why is it important to trust the Medicare trust fund to protect it? Excuse me.
To protect the trust fund. Well, all of the money that we've paid into the system our whole working lives, everybody, it's taxpayers' money. We need to get that money, need to keep that money in the Medicare trust fund for us, for our seniors now, for us when we get 65 and our children. That is our money. That's taxpayer money. So anytime we can get any money reimbursed back into the system is saving. At $60 to $90 billion loss annually, we need to do our part to at least make sure if everyone called about an error they found on their statement and got it reimbursed into Medicare, it would save so much money. Not only that, it tracks providers who continue to bill erroneously, and then which leads to abuse and then later to fraud. So calling and getting any amount that's been improperly paid back into the trust fund is going to save money for us in the future. And we have a great story about that, where $60 to $90 billion seems like a lot. And you think, well, if I call about this $10 error, how is that going to help? That's not going to help much. But we have a story that we like to tell, which kind of impacts that, where a lady was given a flu shot, and this was way back in 1997 or close to that, and it was when the SMP program first started. And the lady called the SMP program and said, I was reading my statement and I noticed that Medicare paid for a flu shot that I don't think they should have paid for. She had to have 2 flu shots because the first serum was wrong, and the clinic called and said she had to come back for another flu shot. When Medicare paid for the second flu shot, she didn't think that was right. She thought that Medicare shouldn't have to pay for that error. So she called the Iowa SMP and they investigated it. And it turned out that the pharmaceutical company who supplied the wrong serum had to reimburse Medicare for this $10 payment that they received. They had to reimburse Medicare $1.3 million back into the trust fund. So you never know what that one phone call is going to do. She was calling to report an error of $10 or less, thinking that she was going to reimburse that $10 back into the trust fund. And it was a lot more than that in the end. So that's another reason.
Okay, thank you. So I have one more question. And the question is, how can I help my grandparents understand scams and the best way to educate them?
Yeah, it's really hard, and especially if they still answer the phone, because a lot of seniors are alone at home. They enjoy getting phone calls. They like telling stories, and these scamsters, unfortunately, target that type of person, and they become friendly to them on the phone. They start asking about grandchildren and, anything they can talk to them about to get them to trust them over the phone. And then they start to get into, well, how is your health? Do you have knee problems? Oh yeah, I've got bad knees. And well, we can give you a brace for that if you like. Well, we just need your Medicare number and then we'll send it to you. It's free. It won't cost you anything. And they end up giving their information away because they've made friends with this caller. If you cannot talk your parent or grandparent into not answering the phone, it's really hard to keep them from giving information away, and you just can't tell them enough. Don't give your personal information. The minute that they start asking for anything Medicare number, social security number, bank information, that they need to hang up, and just tell them it's okay to be rude to these people, that they're just scamsters. And other than that, educating them. And I don't know about parents that have dementias, that you're able to do that. So the best thing is to just not let them answer the phone. I don't know what else to.
Okay.
Unfortunately, it's hard to prevent scams from happening.
Yes, it is. So first, can I thank you for all of that important information out here? And please, my Facebook audience, please like and share. You will be able to find this platform. We will have it on our Facebook page, on our YouTube page, and I'm sure Kathleen is going to have it on her website as well, the recorded version. Thank you so much. Next week, Wednesday, the 29th at noon, we have Dr. Sydney Crawley. She will be talking about COVID-19 and dementia. Of course, you can look at our website at alzark.org/COVID, and we have all our updated information for our Lunch and Learns and the services we are providing at this time. So please feel free to reach out to us, 501-224-0021. And if that's all, Kathleen, I really enjoyed seeing you today. Thank you for all the information, and I hope to see you soon.
I do too. Thanks for having us on today. I appreciate you.
All right, bye-bye.